Hi everyone, my name's Tanya Tarnowski. I'm in the Women's Health Nurse Practitioner Track program at Regis College. This assignment was very interesting, and I like that I was able to relate everything back to my program so that it would most benefit me when I do study for the boards. So that being said, each weekly topic that we were assigned from our professor, I tried to relate back in my pocket guide to something that correlated both ways and was meaningful to my studies. That being said, I used a 3-ring binder. I figured this size made the most sense for me. While it might be a little bit bulkier than a smaller notebook, I figured that when I opened to what I was looking for, all of the information on that topic would be on one page, and that would be helpful. So when you open this binder, I have a title page, and then that is followed by a table of contents. I did purchase some tabs, and I was able to use all of the tabs I purchased for different topics that I researched through the weeks that we were doing this course. I figured this would be easy and best for quick reference when I was in need of help for my pocket guide. So week 1 is levels of prevention, which we actually spent a good amount of time on, and I was able to list out levels of prevention in women's health as well as levels of prevention in the pregnant woman. And I thought that was interesting because there's different things that we do in pregnant women that in just regular women's health. So just to remember all of those extra points. The second tab is the components of a well woman's visit. I was very thorough in this, and it is actually multiple pages long, but I think a thorough assessment is very important for all of our patients. So not only is this about the interview, but it is also about the physical exam and the systems review of each patient. So that is tab 2. Tab 3 is breast cancer screening guidelines and components of a breast self-exam, which as a women's health NP, I should be pretty comfortable in explaining this to my patients, as we should be suggesting to do monthly breast exams. The 4th tab is cervical cancer screening guidelines, and this is a very frequent topic that I will be going over with my patients as well. I also listed off some of the different treatments if the cancer screenings came back positive. My 5th tab has an abundance of information. It is on contraception, all of the different devices and therapies we can do for contraceptive management and family planning. And I also was able to find a nice figure that has the different types of contraceptive management and how effective these methods are. My 6th topic was signs of pregnancy, which was something that I think was important to study in our course as it was on one of our quizzes. So this lists up the presumptive, probable, and positive signs of pregnancy in women. My 7th tab goes over immunizations in pregnancy, and I did take some time to look into the COVID vaccine in pregnancy, as this is a newer vaccine to the market, and how it is a preferred vaccine in pregnancy. And I also highlighted some very important points, including not to give live vaccines to pregnant women, and not only should the gestational carrier be vaccinated, but also educating on legal guardians, parents, and other family who are in close contact with the newborn be vaccinated. I also was able to find a chart from the CDC about the vaccines, including travel vaccines, which is not a topic that is something I see very frequently as I work in an OBGYN setting currently. It's not something that I am well versed in, so this will be very helpful in my studies for the boards. My 8th tab focuses on maternal nutritional needs. It not only goes over the nutritional needs, but what normal weight gain is during pregnancy for my patients, the increase in calorie consumption, and then going over things like how much protein should be in my patient's diet, the different vitamins and minerals, the importance of folic acid and caffeine. I also went over a pregnancy-related problem that some women have, which is called pica, which is a strange craving for things including starch or clay. And I was able to find this graphic, which could be more useful to my patients as it has color and it is a bit more interesting than just my writing. The 9th tab, as we're moving through my pocket guide, is on stages of labor. This is an area that is near and dear to my heart, but would be very important to teach in clinic to my pregnant patients, as they should be aware of the process. It is a problem that I find quite frequently in the hospital, that patients are not quite prepared for how long the process could take. In addition to this, on the 9th tab, I also wanted to give some general information about lacerations, as after delivery it is quite normal for women to have lacerations of the vagina, and I just wanted to review what those were, and how long they could take to heal, or if they would need attention from the OR, or, and if they're actually necessary to repair. The 10th tab was just a really cool graphic that I found. It is about the postpartum assessment. So after the baby arrives, we focus on several topics when we assess the postpartum woman. So this is kind of like the exam of the well woman, but we utilize the term bubble he when assessing the pregnant woman, the postpartum woman. Sorry. This topic on my 11th tab is continence in the elderly woman. So our elderly population is also quite important to remember. I focus my time on different topics that the patient should be prepared with when coming to the office to discuss their continence problems, and then different management styles. This is a topic that sometimes postpartum I also deal with my patients. However, it's not something I'm super familiar with, so this will be very interesting to study. And my last tab, the 12th tab, this week's topic was like pediatrics. So I thought a very important topic that I should be screening every patient for is domestic violence and sexual abuse. So I focused on the identifying sexual abuse in children this week. And there is a lot of key factors to be aware of. So emotional, physical findings, and looking at adults who are taking too much interest in children. And then more of the physical findings can be things that I might experience in the office. And what that also means in my adult patient as they grow out of childhood and they present to me, they're less likely to seek out normal pap smears and prenatal care. So that's important. And then I did include my references just for good measure. There are 2 pages of references here. So I do think that overall I liked how this project built every week upon each other, and how I was able to relate it back to my area of interest. I think it could be very helpful when it becomes time to study for the boards, but also for quick reference. Again, I like the size because I feel, and the tabs I chose because I feel like I will be able to quickly reference. And yeah, so thank you.